For the past 10 years, medical and public health experts have tried to wean patients and doctors off the crutch of prescribed antibiotics. Despite some real success, there is still a big problem. KMU8's Stacy Ike has the details of where we are now.
Federal Food and Drug Administration researchers report antibiotic prescriptions for kids declined 14% from 2002 to 2010. But why?
Parents are understanding, that the pediatrician or ER doctor or urgent care doctor isn't going to, hand them a prescription for antibiotics every time that their kid has a runny nose and a fever, for instance.
Normally, if it's just a little virus, a 24-hour virus, no antibiotic at all. Just go natural.
However, antibiotics still remain the most frequently prescribed drugs for pediatric patients, and amoxicillin leads first.
Doctors have charts of what their first line is for whatever they think the diagnosis is. And amoxicillin, which is a penicillin antibiotic, has been around so long that it's very commonly the first line or the first antibiotic they try.
In comparison, 3.3 billion prescriptions were dispensed for ages 18 and up in 2010, 22% more than 2002, according to government researchers. Dr. Zeller says that is not an easy statistic to digest.
It could be because of new infections or increased incidence of infections. It could be that the message hasn't really been received by adult doctors quite as readily as the pediatricians. So it's kind of a tricky question because there's not necessarily one answer to that. There's different factors that all could be affecting that one way or the other.
To continue the decline in the use of antibiotics, doctors say they must level with their patients.
Explaining to the patient, this set of symptoms is likely viral. Antibiotics do not help a virus.
Keep them hydrated, rest them, and the immune system will take care of it on its own. So basically the tough it out speech.
Zeller says if the decline of overprescribed antibiotics does not continue, it will affect the future of resistant bacteria. Stacy Ike, KMU8 News, Columbia.
Both doctors agree with a reasonable approach and a good follow-up. Patients can continue to be weaned off antibiotics unless they are necessary.
Cardinals